Hi everyone, we are Team 1 and we will be presenting the Forgotten Populations, Healthcare for Undocumented Immigrants. For this presentation, we will be going over the introduction and overview of healthcare for undocumented immigrants, as well as the health policies and insurance coverage, implications, healthcare access, barriers, organizations and programs that provide care, potential solutions and future recommendations, and lastly, the conclusion. Now, I will turn it over to
Hello, everyone. My name is Rose Felipe. I just want to thank Andrea for introducing the topic of our presentation and also providing a table of contents, which I think is a great guide to reference different information from our slides. I'll begin with the introduction and overview, and then later on in the presentation also go into future recommendations and possible solutions to our topic that we will go in depth later on. Now, let's get into the introduction. If we look at our population today and compare health outcomes, it becomes clear that undocumented immigrants and their families face significant challenges with regard to health care access, cost, and quality. With the enactment of the Affordable Care Act, undocumented immigrants are not allowed to purchase coverage in the newly created health exchanges, nor do they have the option to qualify for Medicaid, Medicare, and the Child Health Insurance Program, which leaves many without an option to obtain health care coverage. This is really shocking to me because it's estimated that the U.S. population will increase by 120 million people over the next 50 years, and 80 million will be the direct or indirect consequence of immigration.
Hello, my name is Marquis Sims, and I will be presenting on health policies and insurance coverage in the U.S. Federal health coverage for undocumented immigrants is prohibited, but thanks to the Immigration Modernization Act of 2013, a new status called Registered Provisional Immigrant, or RPI for short, has been made available. Under this act, RPIs are allowed access to the Affordable Care Act marketplace but must pay full price if they choose to participate, which can be very costly. To receive RPI status, two criteria need to be met. The person must have resided in the United States since 2011 and have paid all of their taxes owed to the government. Some states with very large undocumented populations have been using their own power to aid immigrants. Texas chose not to expand Medicaid to keep funding for their safety net hospitals. California uses its Medicaid program, called Medi-Cal, to provide health care for undocumented children under the poverty line, emergency aid for the urgently ill, and pregnancy services for expecting mothers. New York has the most robust immigrant law called Permanent Residence Under Color of Law, or PRUCOL, allowing any undocumented immigrant that isn't being actively pursued by the government for deportation the right to access health care. Thank you, and now I'll hand it over to Mary Nolan.
Hi, this is Mary Nolan, and I will be presenting on the implications of current healthcare policies. As we have stated before, undocumented immigrants receive little to no medical care, and they often find themselves living and working in poor, overcrowded, unsanitary, and toxic environments, which often lead to the suffering of chronic illnesses, work-related injuries, and depression. Restrictions in access to healthcare contribute to the increase of communicable disease. Illegal immigrants, unlike those who are legally admitted for permanent residence, undergo no medical screening to assure that they are not bearing contagious diseases, such as tuberculosis. Tuberculosis, TB, is a disease caused by germs that are spread from person to person through the air. People with TB can die if they do not get treatment. As required by the U.S. law, any child or adult who is becoming a permanent U.S. resident needs an overseas medical exam, which includes testing for TB. But this does not apply to undocumented immigrants entering the U.S., resulting in an increased threat of communicable disease. Another implication, as stated by UCLA's Center of Health Policy Research in 2012, they stated that undocumented women did not receive adequate prenatal care. Nearly half did not receive the ideal number of prenatal care visits compared with 1/5 of documented women. In addition, due to the lack of proper health care, undocumented women were more likely to be anemic and less likely to gain sufficient weight during pregnancy. Undocumented women are more likely to have complications of delivery, fatal distress, and abnormal conditions such as infant anemia and seizures. This last implication that I will be addressing today is very important because many undocumented immigrants rely heavily on self-treating and self-prescribing with home remedies, which include both medical herbs and over-the-counter medications, in an attempt to provide temporary ease to their health problems. Many Latino immigrants purchase medications without a prescription in Latino markets, or they ask family members who are allowed to travel to bring back medication. Immigrants who self-prescribe often obtain information on medication from pharmacy attendants or family members who have no formal health-related training. In conclusion, the lack of professional medical advice may lead to the misuse of medications and can contribute to the severe health problems in the long run, including death. And now, I would like to turn it over to Andrea Calizo, who will talk about healthcare access.
Hi everyone, my name is Andrea Calizo and I will be presenting healthcare access among undocumented immigrants and their families. So there are three main ways that undocumented immigrants use to access healthcare. I will be talking about Emergency Medical Treatment and Labor Act, or EMTALA, Emergency Medicaid, and Safety Net Providers. Emergency Medical Treatment and Labor Act, or EMTALA, requires hospitals to provide care to anyone needing emergency treatment, regardless of citizenship, legal status, or ability to pay. Emergency Medicaid is only available to individuals regardless of legal status who are acutely ill where failure to receive medical care would place their health in serious predicament. It pays for the emergency treatment if the individual meets the program's eligibility requirements. Safety net providers provide both primary and preventive care to insured and uninsured individuals regardless of their ability to pay or legal status. Examples include community health centers, rural clinics, public hospitals, local health departments, and federally qualified health centers. The Affordable Care Act authorized $11 billion of new funding to sustain safety net centers, which will enable these centers to double their current capacity and serve 40 million patients by the end of 2015. Thank you, and now I will turn it over to...
My name is Philippe Krevker. I'm going to present healthcare barriers. The first cause that prevents access to healthcare for undocumented immigrants is lack of lawful immigration documents, such as permanent residence card, also known as green card, work authorization card, and social security number. The second cause that prevents access is lack of health coverage. For example, low skilled jobs to the undocumented immigrants, lack of financial resources to enroll in a health coverage prevent them not to have coverage. And employers do not offer health coverage to the undocumented immigrants who work for them. The third cause that prevents access is health policy reform. Reform of WOA of 1996 has changed health privileges to undocumented immigrants. It prevents them to benefit health preventive services such as wellness care, screening tests. The ACA of 2010 should allow undocumented immigrants to receive federal and state health services nationwide.
Hi, my name is Sabrina Shaktora, and I'm going to be going over organizations and programs that provide service to undocumented immigrants. Certain organizations are federally mandated by certain statutes under EMTALA to provide emergency care. These organizations are facilities with emergency departments, which accept payment from Department of Health and Human Services and Centers for Medicare and Medicaid Services under the Medicare program. These are hospitals, rural hospitals, any place that has something that qualifies as an emergency department that can provide care. Specific organizations providing health care for undocumented immigrants are safety net facilities. These include community health centers, federally qualified health centers. These health centers get a lot of their funding from the federal government and certain types of other grants. An example is Community of Hope, which is a FQHC in Washington, D.C., which specifically provides care to homeless, underinsured, undocumented patients in the D.C. area. They also have a specific grant in which they specifically care for undocumented patients from Ethiopia, from West Africa, and other places. Lastly, there are government-funded programs which qualify under different FQHCs and CHCs that give, and the Department of Health that give care to patients. VFC vaccines are specifically for children who are on Medicaid or who are undocumented or underinsured. Section 317 offers vaccines to undocumented adults, and the Title X program actually offers reproductive and safety health care to patients in terms of things such as STI testing, IUD insertion, contraception, things like that. That's the end of this section, and now I will pass you over to the next one.
Hello, my name is Rose Felipe, and as I mentioned in the introduction and brief overview, I will also be going over potential solutions and future recommendations. So let's jump into the first potential solution, which is federally qualified health centers. These clinics provide direct access to health services for immigrants. They treat all visitors without reviewing immigration status or ability to pay for care. Another solution is the disproportionate share hospitals, also known as DSH. These programs fund hospital care for uninsured individuals. Together with the Medicare and Medicaid DSH programs, they provide more than $20 billion to qualified hospitals annually. Another potential solution is local organizations and safety net clinics. For example, here locally, near many of us in Washington, D.C., the Alliance Insurance Program, which is funded by the city, offers free health insurance. 90% of those covered are undocumented immigrants who are not eligible for federal incentives. Lastly, safety net clinics, which provide free or low-cost care to communities all over the U.S. They look heavily at the needs of undocumented immigrants. However, not much is known about the healthcare needs of undocumented patients because they often use emergency rooms for all of their medical needs and care. This also leads to providers not being able to track adequate data and statistics on undocumented immigrants, healthcare issues, and usage. With the rollout of the ACA and provisions, it's important to think about how many potential clients these safety net clinics should plan for and how to adequately address these populations' needs. How can safety net clinics work with hospitals to track down undocumented immigrants and move them to their clinics? Looking into the future, we need to support the federal government's decision to exclude undocumented immigrants by continuing to support the above solutions, both with funding and workforce. And with workforce, I mean ensuring that these facilities are housed with culturally and linguistically competent medical staff to support the many different backgrounds and populations of undocumented immigrants.
In conclusion, access to quality, affordable care is a right that should be guaranteed to everyone regardless of their immigration status. Many states throughout the U.S. have pretty strict laws on health care and who they will and will not allow to receive health care. This needs to change. Access for undocumented immigrants is marginal at best and does not provide nearly enough coverage to make a significant impact in their care. A shift has to be made from mainly providing emergency care to undocumented immigrants to providing a substantial amount of preventative care. EMTALA is the majority of care that patients get who are undocumented in the U.S. While they have safety net facilities they can fall on, many of them are not able to rely on these or do not know that they exist. Therefore, we really have to push for better policy change, reform, more education for others about how preventative care will actually help save money in the long run by providing it to undocumented immigrants versus only focusing on emergency care.
On behalf of my team, thank you for watching our presentation. We hope you enjoyed it and find it insightful. If you have any questions or feedback, we'd be happy to assist you in any way we can. Thank you.